Hello, everyone. Welcome back to another episode of 2 Minute Emergency. I am your host, Dr. Lester, board certified emergency physician, best-selling author, international speaker, and professional photographer. And I am here to give you tips to keep you healthy, safe, and out of the emergency department. So I'm coming to you a little bit later than usual. I had a lot going on today, but I did not want to miss this topic. So today's topic is immunizations. Now, we are hearing a lot, of course, about the COVID vaccination, but this is not what I'm here to talk about today. I don't want you to forget about the other vaccinations that you still need to get. Now, children are getting ready to go back to school. In some places physically, other places, of course, are still remaining virtual, but it's important to remember it's time, whether they go back or not, for both the children as well as you. Make sure you're up to date on your immunizations. The first one is one that we think about every fall, which is the flu. The flu vaccine, you need to get that every single year because there's mutations constantly with the virus, and you want to make sure that you're prepared. Easy. I've been getting them my whole life. Very little complications to them, except the only people that have problems with the vaccination, some of these vaccinations, are people that are allergic to eggs. Unfortunately, I'm not in that group, but there are some people who are. There are also people who are allergic to, and this is in vaccines in general, some of the vaccines are made with derivatives that come from um, bovine, some come from horse serum, things like that that you can use. They're all synthetic, but if you have problems with these, make sure you check with your doctor first so that you can make sure that they don't cause you any harm. So, number one is the influenza vaccine. Important to get. The second one is the pneumococcal vaccine or the pneumonia vaccine. So this is more important for those individuals that are over the age of 65 because yes, pneumonia can kill. And this is something that's easily preventable and it 100% protects you from getting the disease. So, easy one to make sure that you get. Now, there are several others that you always have to keep in mind. One of them is hepatitis A. So, hepatitis A is more common in certain communities or areas where it's endemic. So, if you're traveling, you want to make sure that you're covered. So, hepatitis A can be found in things like foods, if it's not cleaned properly. It's also easily transmitted through sexual contact, as well as IV drug use or any type of sharing of needles. So that's one that you also need to make sure that you get. And on that same line is hepatitis B, which is also predominantly sexually transmitted or through any bodily fluids. Make sure that you are covered. All right? Another one is measles, mumps, and rubella. So that is one of those vaccinations that most of us get as children and don't have to worry about it ever again. But once again, if we're talking about children, make sure that you have your children vaccinated. And at the very end, I'm going to give you a link to a website where you can actually print out your own copy of vaccination records. In other words, what you need for you and your child throughout your lifetime. So let's make it really simple, and at the end, don't forget to get that link. All right, another one is chickenpox. Now, I grew up in the time period where if someone got chickenpox, anybody on the block, any of your friends got chickenpox, you would have a party. I know, it sounds horrible, but everyone would get together so that everyone would have chickenpox at the same time and you wouldn't have to worry about it going forward. The reason that that was done then, before the vaccine that we have now, is because as we get older, chickenpox can become more and more dangerous. As you get to the elderly, chickenpox can actually kill. It is 100% avoidable and miserable if you do get it. So the varicella vaccine is out there. Please make sure, pretty much anybody, oh, I don't want to give you years, that would give away how old I am. But anyway, anyone who is under the age of 50, make sure that you have the varicella vaccine. Another one that is for those people who are 50 and older is the shingles vaccine. And I believe it's called Shingrix. Let me make sure I have that right. Yes, Shingrix. Tongue twister. Because shingles is, I'm sure you've heard about it before, but it's a rash-like illness that is very, very painful. And it actually comes from the herpes virus. So anytime you've had even that little cold sore, that's the herpes virus as well. And herpes virus, once you get it, stays with you for your life. Yes. So what happens is it actually embeds into, I'm going to get scientific on the dorsal ganglion roots of the nervous system. And under times of stress, infection, illness, things like that, it can come out as shingles. Very painful, and not only is it painful when you actually see the rash, but you can have continued nerve pain even after all the signs of the rash have gone. So that Shingrix vaccine is one that is going to prevent you from going through yet another miserable circumstance. So if you can do without that, please do. One of the last ones I want to talk about is the tetanus vaccine. So tetanus vaccine should be updated every 10 years. So most people think about it, the last one they get, age 14, going forward, at least every 10 years. So some people say every 7 to 10 years, because most people don't remember, when was it exactly that I got that? That's one of those questions that I ask in the emergency department of any patients who come in with any types of wounds, or if they've had an injury to their eye, things like that, because we do not want to get tetanus. And something easily that if you are in an accident and you remember, I remember the last time I got that. I got that vaccine when I was in that car accident. So it's an easy way of remembering. Associated with tetanus is also the diphtheria, as well as the pertussis. Now, pertussis leads to whooping cough. So if you've been vaccinated and you've gotten all of these vaccines, you are protecting not only yourself, but if you're around small children, especially if you're over the age of 65, so I'm talking about the grandparents out there, 65 and older, you want to make sure that you have gotten your Tdap, your prevent from passing whooping cough to those infants. Now, as adults, we may have a little cough or be essentially asymptomatic, but whooping cough can be so dangerous to those infants and require hospitalization. So you want to keep yourself safe, but you also want to keep your family safe. So these are just some of the important vaccines to make sure you get. And I am going to put this down here so that you can see. This is the link to the CDC site. I just kind of shortened it because it's a really long thing for you to try to write down. So this is the bit.ly link, but if you go to bit.ly, Dr. Leslie Vaccines, you will get that directly from the CDC. I'm not collecting any information for you or anything like that, but I want you to make sure you have that and keep it with you. And please, print it out, make copies, give them to your friends, to your family, and make sure everyone around you is covered as well. Because vaccines help save lives. Immunizations can prevent things so easily because there are different types of vaccines. I want to make sure that you know. And with those, there are those that are live vaccines where you're actually getting a part of the virus. These are attenuated, so they're not harmful at all, but it's a little piece of the virus. There are those vaccines that are inactive, which means it's basically a dead virus. But each one of these helps to, when it gets in touch with your immune system, the immune system says, this is foreign, I don't like this. So I'm going to produce something to counteract this. And that's what vaccines do. So other types there are those made with small proteins, or even the covering of a vaccine. Same effect, as the body says, not right, I'm going to fight this. Others are toxoids. And people say, it's a toxin made by the virus, why would I want that? Well, think about it. All those people out there that get Botox, that's exactly what you're using. So as I said, not all are dangerous. Keep in mind vaccines are good for you. The fourth type is mRNA vaccines, which, if you're familiar with some of the COVID vaccines, they're made with mRNA. And what it does is that is the messenger RNA, and it tells your cells how to make a part of the protein of the virus or germ so that you can fight against that virus. And the last one is actually called viral vectors. And what they do is similar to what the mRNA does. It tells your body how to make a part of that virus, but it also takes a secondary harmless virus and attaches to that so that your genetic material can absorb it and fight to make those proteins. So I hope that helped you to learn a little bit more about vaccines and the importance of making sure that you get through it. So please look at the link right here, copy it down, or if you want to, you can easily see this video or just catch the end part. You can go to my YouTube channel, Dr. Leslie Sharp, and you can catch this and all of my 2-minute emergencies so you can learn more facts to keep you healthy, safe, and out of the emergency department. So once again, I am Dr. Leslie, board-certified emergency physician, best-selling author, international speaker, and professional photographer. And I want you to stay healthy, safe, and out of the emergency department. Until next time, be well. Bye for now.